Thank you very much. Hi, everyone. Good afternoon. I just got a lot to talk about today, and I got a lot of questions ahead of time as well. So let's get going. I just wanted to, just before I go off, to remind you that Monday we're not having a conference, a press conference. We're doing it on Tuesday instead because of the Easter weekend. But tomorrow we will it's a stat holiday for us tomorrow and Monday. But exceptionally, on Monday, we will be updating our website for the previous 3 days in terms of numbers for you. But we will not have a press conference on the Monday. We'll have it on the Tuesday instead. So let's get on with the provincial picture. First of all, top of mind right now is obviously the announcement that was made today, which is not a surprise. We're going into shutdown effective at a provincial level, effective Saturday morning, April 3rd. The numbers have just gone up. 2,500 today. I know that tomorrow it's going to be over 3,000. I was speaking to the ministry about that. Record ICU admissions in a day across the province, having a predominance of VOCs, having as well increasing in the VOC ability to hospitalize. It's a 1.5 times higher than the original ones, both for hospitalization rates and death rates, and twice the rate of admission to hospital, twice the chance for being admitted to hospital. So to ICU actually. We're also seeing increasing number of younger people being in the ICU and having more severe symptoms with the VOCs. As a matter of fact, in this fall, the rate of people in the ICU that were less than 60 years of age was less than 30%. Now it's upwards to 50%. So all of these things put together, the numbers going up across the province, including our area. The government has instituted a province-wide shutdown with multiple closures. We don't have the full regulation right now, but it will basically prohibit indoor organized events, outdoors, no social gathering beyond 5 people, restricting in-person shopping in essentials is 50%, it's non-essentials 25%, retail, closure of personal service settings, no indoor or outdoor dining in restaurants, no use of no indoor or outdoor sports and indoor facilities closed, including gyms, and then limiting capacity in terms of churches to 15% indoor capacity for rights. No receptions are not allowed. That's part of it. We don't have the full amount. What's missing there is a stay-at-home order, which we wanted to have. The modeling by the government, by the science table, actually showed that if you don't have a stay-at-home order and people still are allowed to socially gather, you will not decrease the wave, even if you vaccinate a lot of people. So anyway, we're going to see what's going on with that. I believe that lockdowns alone, are not as effective as adding either a curfew or a stay-at-home order, because again, in our situation, we're seeing more of these cases, in social gatherings and those type of things. So that's why I just want to clarify that. Yes, essentially Toronto was locked down for all these periods of time, and really not much changed. Cases are still going up and being up at the upper limit. So again, I think that we've raised our concern. This is what we recommended, and we'll see what happens. At this point, like I said, this is the emergency break provincially. It's across the board, and really most health units were up there, including ours, in terms of our numbers. So I'll share our numbers right now. When we talk about cases in our area, we're up to 355 active cases. We've got 32 hospitalized and 8 in the ICU at this point in time, and we have 82 deaths. And I know that we've added 7. 5 come from the Hawkesbury Hospital, and 2 come from separate both Cornwall residents. One died in hospital and one in Cornwall, and so elderly. So that's where the 7 came from, because I know we jumped up from 7 in that regard. In terms of our rolling, well, first of all, let's look at our change. We added 15 today. I added 32 today, 15 in Akwesasne, 6 in Cornwall, 2 in SDNG, and 9 there. So we've added 32 in total. And over the last couple of days, we've been hovering 22, 28, 45 day. And so if you look at our rolling average, again, we're still, there's a bit of a slight decrease, but we're still clearly in, high red into gray zone here. So this is not different from a lot of other health units across the province. Most of them are in red and teetering on gray. Only a small minority are in orange and yellow. Across Eastern Ontario, across Ontario itself. So that is something that we are worried about, and I think that, like I said, the lockdown. I'm hoping the lockdown will work, but I think that a stay-at-home order would have been required. I also think that. In the absence of the stay-at-home order, what we're asking people, obviously, with a weekend coming up, there are no gatherings at all. Please stay at home as much as you can. Only go out for essential purposes. Let's ride it out. I know this is going to be for the next 4 weeks. I do anticipate seeing perhaps fruits of our labor in a couple of weeks. Unlike previous lockdowns that I've said before, is that we're going to be going into a vaccinated situation as compared to what we did, with previous lockdowns. So to me, it's quite important that we continue and just act as if there's an stay-at-home order. Don't mingle with others. It's really a matter of time until we're able to vaccinate enough people, and I will be talking about that just in a couple of minutes. Again, Easter is coming over the weekend, long weekend. Temptation to get together with people outside your home. Please do not. Very important that we adhere to these measures. The next couple of weeks will be very important. The more we adhere to them, the quicker we'll be able to breathe a sigh of relief and relieve our strain on what's happening now across the healthcare system across Ontario. So again, this is unfortunate, but it was inevitable. We saw it coming. We saw the numbers going up incessantly. So it's quite important that we move forward in that regard. In terms of our schools, we've had a couple more cases. I don't have the statistics now, but I know that we will likely be adding 2 more outbreaks in our area. This is, again, not from the school. It's actually from the community into the school. And so, again, it's a reflection of what is there. I just want to stress that at this point, there is no indication that there is a desire to close schools, even during the shutdown. So there are plans that the schools will reopen after the Easter holiday break, and then go on to their scheduled, postponed April break. Again, there may be certain areas and certain situations where there may be some local Section 22 by Medical Office of Health, but provincially, at this point, the schools will remain open. There's the science table looked at today, actually made a presentation where they talked about the VOCs. They also talked about the concern of, disruptions to kids, inequities of learning and so on. So we're going to try our best, and the government wants to try its best to, despite, the shutdown, at least because they consider the schooling an essential service, really. So that's where we are with that, because I know I had a question about that from somebody before in one of the media questions that were submitted. Again, in terms of our outbreaks, again, the outbreaks that we have, with the exception of McConnell Manor, really are no residents. The only one that we had that is a resident is one new one that is at the St. Joseph continuing care complex, which is not the St. Josephville. It's the one next door. They're not vaccinated yet, and there was one resident, and that's it. And things to be stable there. So again, the good news is that the elderly are being spared now, and it's shifted downwards, unfortunately, with what seems to be a more virulent, a stronger, if you like, infectious agent, which are the variants of concern. In terms of vaccinations, so let's talk now positive. And by the way, in terms of our if you look at our statistics in Ontario, in our area, we've got over 265 VOCs, and our percentage is about almost 70% of all our cases, our positive cases are VOCs, and the Ontario average is about 60%. So just to show you, we've got a really, it's almost all of our cases are VOCs, and they really do spread a lot. And again, we've been seeing them, one-offs, people getting together, going home, and infecting the whole family. That's exactly what we're seeing. As we look at the contact tracing and so on. So I think that now we'll talk about some vaccines. Our report today showed that we vaccinated close to 26,000, give or take. We're probably 1,000 to 1,500 short, so we're close to about 27,000 vaccinations, if not 27,500 vaccinations, because the some that we haven't recorded yet in COVAX, and we don't count today. We have a couple of clinics today, and we've got clinics between now and Sunday and Monday. So we haven't included those in over the weekend. So we're doing well. We are expecting to receive another 40,000 doses between now, including this past week, and into May 10th. We are at this point also been told that we will be allocated some AstraZeneca so we can share with some of our primary care providers. We are not sure when we'll be receiving it, but I know that it's landed already. It's the one from the United States. Also, we know that so far, again, there's going to be 3 pharmacies, and we did not really have much of a say in this, but there are going to be 3 in our area. One is going to be in Winchester, one is going to be in Embrun, and one is going to be in Hawkesbury. I know that there are going to be more coming, and so stay tuned for that. And again, I'm not sure about the timelines of it. As you know, the AstraZeneca vaccine has paused for people below 55 years of age, and that's going to continue until we get some updates from Health Canada that is looking at the data moving forward. In terms of what we've done now, I just want to sort of talk to you about our planning into next week. We were ready to start with our 70 plus. Really early on in this week when we got the call, but we had not our clinics were not put into the system yet, and so we sent all the clinics. It takes about a couple of days for them to make sure that all of them are in there. We added four clinics between now and April 9th because we already had 37 from March 17th to April 9th. But we've added 4 more. Actually, 2 we've expanded, and we've added 2 extra ones because before that they were all booked. We had over 12,000 booked in those, and we've also added 8 clinics per week, 8 mass immunization clinics per week for the next 4 weeks between April 9th and May, the first week of May. So there's going to be a lot of clinics going on, and I'm told that as of tonight, we're just verifying because we put all these new clinics in. We just want to make sure they're all in and all with the appropriate number of dosages, because we have to program it and send the templates to the ministry that uploads it to ensure that the correct number of spots are allocated and so on. So, and as you know, we've had problems both times. One of those 80 plus and the 70 plus. So tomorrow, I do believe that we'll be able to share with everybody that 70 plus is open in our area. We're also looking at the other groups that we're doing, planning for the other groups into phase 2. Again, we're kind of quasi into phase 2, but not fully. So we're waiting for some direction from the ministry. I know that I've had some questions from the media about that one as well. So we're not really sure when we'll go into full phase 2, but in terms of the age groups, we've already started, and I'm anticipating that we will be going lower age groups probably over the next week or 2 as well, even lower than 70 moving forward. So that's good news. And the other thing is the allocations that I talked to you about and receiving and what we're expecting to receive over the next month does not include Johnson & Johnson. There will be a delivery of Johnson & Johnson vaccine by the end of April, and does not include there's an increased supply of Moderna, there's an increased supply of Pfizer that was announced recently that's coming to Canada. So Again, I'm optimistic that we'll be having more vaccine available to us as we move forward. And again, I believe that with all these numbers and all the clinics that we've set up, uh, as well as now pharmacies getting it, primary care getting the vaccines, and then more availability across our area, we'll be able to have vaccinated, substantially more people between now and the end of the shutdown. So I do believe that we'll have that'll have an impact with the shutdown and staying at home as much as possible. That'll have a real positive impact on the numbers. We want the vaccine numbers to go up and obviously the case numbers to go down. Bonjour tout le monde. Je vais commencer avec les nouvelles ontariennes. Comme vous avez entendu, bien sûr, qu'aujourd'hui, la province a annoncé qu'on va aller dans shutdown. Bon Dieu, j'ai oublié le mot français, mais on commence dès samedi qui vient, avec la fermeture des restaurants au niveau on ne peut pas dîner à l'intérieur. Il n'y a pas de rassemblement de tout dans l'intérieur. À l'extérieur, c'est 5 personnes maximum. Au niveau des magasins, les magasins essentiels limités à 50 des personnes qui pourront avoir et 25 pour les autres détaillants. Les services de soins personnels, barbiers, coiffeurs, etc., sont fermés. Aussi, il n'y a pas de sport compétitif, aucun sport, aucun gymnase ouvert. Et aussi, on continue avec les limites au niveau de l'église, etc., 15 de maximum à l'intérieur. Sûrement, il y a d'autres, mais on n'a pas toutes les régulations. On va les mettre sur nos sites web. Donc, ça a commencé. Et la raison pour laquelle ceci est arrivé, c'est que nous voyons un trajet non satisfaisant, si vous voulez, au niveau des cas que nous avons en Ontario. En effet, on approche demain, il va y avoir 3000 cas de plus ajoutés de façon à travers l'Ontario. Nous voyons la même dans notre région, je vais parler tantôt, mais à travers l'Ontario, on voit que plus que 60 des cas sont des variantes. Et nous savons aussi, selon la table de sciences scientifiques d'Ontario, que ces variantes, on a 50 plus chance d'être transmis et 50 plus chance d'être hospitalisé et de mourir. Et 100 plus, doubler la chance d'être admis à soins intensifs. Et nos soins intensifs avaient un record dans une journée, la plus admission depuis la première vague qu'on avait en mois de mars passé. Donc, on voit tous les trajets, toutes les statistiques qui vont de la mauvaise direction. Nous avons aussi constaté que en mois de novembre, il y a peut-être un tiers ou moins étaient en bas de 60 ans au niveau de personnes aux soins intensifs, mais actuellement, on est rendu à 50 ou plus qui sont à l'hôpital aux soins intensifs. Et nous savons que si on n'arrête pas, on pourrait avoir des modèles qui nous disent qu'on pourrait avoir 8 à 10 000 cas par jour. Ceci va tout déborder nos systèmes. Ça va être une catastrophe si on continue comme ça. Et la seule moyenne pour le prévenir, c'est vraiment de continuer avec le vaccin, mais ça ne marche pas juste avec le vaccin. Il fallait qu'on prenne des mesures plus restrictives comme on a fait aujourd'hui. Moi, je voudrais qu'on aurait aussi un ordre de rester chez vous, mais malgré qu'on n'a pas cet ordre officiel, je vous prie de rester chez vous le plus possible. Sortez pour les raisons, les fins essentielles. Si vous pouvez travailler à la maison, travaillez à la maison. Et de ne pas avoir des rassemblements. Surtout maintenant, on rentre de fin de semaine de Pâques, de rester chez vous avec juste les personnes qui demeurent avec vous, avoir des réunions virtuelles, mais pas personnelles, parce que c'est important qu'on le fait, parce que si on perd le contrôle des variantes, on va avoir beaucoup plus de cas, beaucoup plus d'effets nocifs. Donc, le mieux qu'on peut diminuer ces cas, le mieux qu'on va être. Ceci va être pour 4 semaines, puis on va réévaluer dans 2 semaines. Je crois qu'on pourra avoir un peu d'amélioration dans 2-3 semaines, mais aujourd'hui, c'était annoncé pour 4 semaines qui va commencer à minuit, en effet, minuit et une, samedi matin, soit le 3 avril. Au niveau de nos cas locaux, je vais partager mon écran. Encore, nous avons des augmentations pas mal importantes. On est rendu à 350 cas actifs. Nous avons 32 patients hospitalisés, 8 aux soins intensifs, 82 décès. Nous avons ajouté 7 décès, 5 de l'hôpital Hawkesbury, c'était l'éclosion là, et 2 autres des personnes de Cornwall, âgées plus que 70 ans. En effet, même une décès est plus qu'on veut, là, c'est tragique. Mais on voit que on voit qu'au niveau des mortalités qu'on verrait, qu'on voyait aux maisons de longue durée sont diminuées, sont pratiquement disparues à cause qu'on les a vaccinés. On a 14 éclosions, et puis la plupart des éclosions, comme ont pas de résidents. C'est juste 2 qui sont des résidents parmi les 14 que nous avons. Je vais parler avec des vaccins tantôt, mais juste pour vous donner la variation aujourd'hui, nous avons ajouté 32 cas, donc 15 de Akwesasne, 6 de Cornwall, 2 de SDNG et 9 de Prescott Russell. Et on voit le trajet. La moyenne, c'est 25 à 35. C'est ça qu'on voit depuis quelques jours. Et la fin de semaine, on est dans le 80. Donc, on a beaucoup de cas ajoutés. Et comme vous pouvez voir ici au niveau des mobiles, ici les moyennes mobiles, on voit que nettement, nous sommes encore dans la zone vraiment rouge élevé, dans la zone gris. En effet, effectivement, c'est vraiment la période de shutdown ou lockdown pour nous. Même si ce n'était pas provincial, on l'approchait dans notre région avec tous les cas que nous voyons ici. Donc, c'est très important de continuer vraiment de respecter toutes les précautions de santé publique et un peu plus de patience, mais pour comprendre que c'est le temps vraiment de faire attention, beaucoup plus attention aux ces mesures. Et ça va prendre quelques semaines. Les bonnes nouvelles, c'est qu'on est en train de vacciner, on va vacciner beaucoup plus du monde. On va rentrer dans une période d'été. Donc, on pourrait envisager qu'on va être dans une meilleure place, si vous voulez, après les 3-4 semaines, avec toutes les restrictions qu'on va avoir d'ici fin avril, en effet. Et à ce moment-là, je pense que ça va être un meilleur temps pour nous. C'est la première fois qu'on peut dire oui, on sort des restrictions, mais là, on a beaucoup de gens à vacciner. Ça fait beau, on pourrait mieux, on pourrait avoir des établissements à l'extérieur, etc. Mais pour le moment, il faut toujours respecter les masques, malgré les masques, même si on est vacciné, les masques, les distances physiques, etc. Donc, j'ai parlé au niveau des éclosions. Comme j'ai dit, on a juste deux maisons. Une, celle-là de McConnell Manor, qui a des résidents qui étaient positifs, et Centre de soins Saint-Joseph, le complexe, pas la maison de longue durée, avec une patiente qui était positif, mais aucun autre problème. Ce patient n'était pas vacciné encore. Donc, on va parler un peu de vaccins. Ça, c'est des bonnes nouvelles. Aujourd'hui, on est rendu à plus que 26 000, presque 27 000 doses de données dans notre région. Nous attendons un autre 40 000 avec cette semaine jusqu'aux première semaine de mai. C'est plutôt du Moderna et du Pfizer qu'on va recevoir. Nous allons aussi recevoir de AstraZeneca pour nos cliniques des soins primaires et aussi nous aurons 3 pharmacies en commencement. Il va y avoir plus, mais qui vont recevoir l'AstraZeneca très bientôt. Ça va être une à Embrun, une à Hawkesbury et l'autre à Winchester, mais on va avoir plus aussi. Donc, on va commencer à avoir beaucoup plus de choix de recevoir le vaccin. Au niveau de l'AstraZeneca, on reste toujours avec 55 et plus en attendant l'étude de Santé Canada. Au niveau où on est rendu maintenant, à cause qu'on a été demandé début de semaine, est-ce qu'on est prêt pour les 70? On a dit pas avec les cliniques qu'on a actuellement parce que tous nos cliniques étaient pleins. On a eu 37 cliniques avec 14 à Cornwall qui étaient vraiment qui était ciblé pour les 80 et plus, et on avait diminué à 75, mais ils étaient pleins, plus que 12 000 personnes. Donc, nous avons dit au ministère, oui, on va vous donner des autres cliniques, on va créer d'autres cliniques. On a ajouté quatre autres cliniques jusqu'aux premières semaines d'avril, et après ça, nous avons ajouté 8 cliniques par semaine pour les prochaines 4 semaines jusqu'aux premières semaines du mois de mai. Mais nous avons résisté à dire aux gens d'aller faire enregistrer 70 et plus parce qu'on voudrait être sûr que tous les cliniques étaient mis dans l'ordinateur parce qu'on a eu une mauvaise expérience deux fois que malgré que nous avons donné les cliniques, ils n'étaient pas bien placés, donc les personnes n'étaient pas capables de prendre des rendez-vous. Donc, je pense qu'on va avoir nos réunions à 6 heures ce soir et selon ce que je peux voir, si tout va bien, demain, on va annoncer que les personnes de 70 et plus pourront prendre le rendez-vous. Et je pense que la semaine prochaine, ou peut-être d'ici 1-2 semaines, on va aller plus bas avec l'âge aussi. Donc, ça, c'est vraiment des nouvelles que nous avons au niveau des vaccins, mais encore, la situation, c'est qu'au niveau des cas que nous avons, ils vont à la mauvaise direction. On veut que ça commence à diminuer et donc ça prend, oui, le vaccin, donc on aurait la chance de vacciner pas mal du monde d'ici fin avril et d'ici fin sous ce confinement que nous aurons pour les prochaines 4 semaines. Et je pense qu'on va être dans une meilleure place. Donc, ça m'encourage. Je pense que c'est encourageant, mais pour le moment, on doit vraiment respecter les normes. Restez chez vous, sauf pour les fins essentielles, pas de rassemblement de tout. Et je pense qu'on va avoir la situation va s'améliorer de façon très, très positive. So I'm going to take some questions now that I've got from the media here, and let me see. The first one addressed I've addressed it. It was from TVC 22 about schools. I've addressed that one. Another one about percentage of staff members of EOHU long-term care facilities. I don't have the data as the top of my head, but I do have the data, Nick. I can tell you that some were quite high, like 100%, and one of them, and some were a bit lower. So I'm not even going to venture to guess. I know that provincially it ranges, but I can get that for you. And then about flu cases, yeah, we haven't had any flu cases this year, and so yes, I do believe that the public health measures that we took prevented the flu, as well as we vaccinated more people this year. But I do believe that as well. And if you look at other respiratory illnesses like RSV and other respiratory viruses, they were down as well because they're all spread the same way. So it makes sense that they would be lower. Donc, on a ici Tribune Express, le dépistage de COVID utilisant les tests salivaires au boucan est disponible. Oui, on est en train de voir aussi pour notre région aussi. On n'a pas ça encore, mais on est en train de voir. On a une équipe qui travaille sur les tests salivaires et buccales, etc. Donc, on aurait des nouvelles bientôt pour ça. I have another one regarding from CBC. Can you let me know if the 5 deaths at the hospital are still being counted as COVID deaths? Yes, we're counting them as 5 COVID deaths. I know there were a total of 7, but the 5 were from Ontario, so they are considered 5 COVID deaths. I've given you the breakdown there. That's... We've got right now we have a question here about the Hawkesbury Hospital. How many outbreaks of there's actually one, and there was a second one added because it was another ward, so we consider as two, but they're almost at the same time. Let's see the other ones here. Is there a male in his 50s among the individuals currently on the ventilator from the EOHU region? Yes, in fact, there are two individuals who are in their 50s who are in the ICU at this point. Which just shows us that the age groups are getting younger that are going in the ICU. And like I said, I just answered that. And the others, the remainder are older. They're in their 60s, 70s. But there are two that are in the ICU at this point in time that are in their 50s. Asked about Cornwall and SDNG getting pharmacies. I've answered that already. Phase two, I've answered that as well. Again, I'm hoping sooner the better. No, fortunately, the question here is this is a good question. I'm going to answer. I'm going to ask it in French as well. Are there any indications that the vaccines are less efficient against variants of concern? No, fortunately, they seem to be effective, particularly against the UK version. There have been some concerns about the South African one, but the vast majority of what we're seeing now are the UK version. La question était, est-ce que il y a la possibilité que le vaccin soit moins efficace sur les variantes? Et ma réponse, heureusement, non pour la souche britannique. Ça a l'air que ils sont aussi efficaces, sont moins efficaces pour les souches Afrique, Sud-Afrique, mais on n'a pas beaucoup. La plupart des 99% de tous nos cas en Ontario sont des souches ontariennes. And I explained about the deaths. And any recent deaths been young people? Not recently. We had a 51-year-old that died, but this is about several months ago. And that's it, Jenna. I'll take some questions.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. I've got a couple questions here. The first one, the announced shutdown. During the announcement, Premier Ford switched back and forth between the terms of lockdown and shutdown.
Yeah.
And this has caused some confusion with what the restrictions are going to be. Specifically, golf courses and conservation areas. Are golf courses going to be allowed to remain open during the 28-day period? If so, great. If not, why not? And our conservation hours?
Yes, they'll be open.
Okay. Second, you were talking about the 3 pharmacies in the EOHU that will be offering the vaccines.
Yep.
I was talking to the one in Winchester at lunchtime, and they said it's an error. They're not supposed to be on there. They've gotten over 200 phone calls by lunchtime asking about it, and they had just applied for it. They're not part of it, and they've asked to be removed from it. So is this all part of an error, or?
That's an error. I also want to say that we had no say in which pharmacies got it. I believe it or not, I got the PowerPoint presentation of all the pharmacies that are getting it in Ontario about an hour before this session.
Okay.
So I just got it now. And what I saw, and I didn't know this, I will follow up, obviously. Okay. I have asked the ministry, can we recommend pharmacies, because I wanted to be spread out geographically, in the areas. And so they had told us yes, but then all of a sudden I got this. This is just a first swath. I don't understand why, but I can tell you that that's what it showed. It showed that it's the pharmacy in Winchester, it's a pharmacy in Embroom, and a pharmacy in Hawkesbury.
Right. And because are we actually being added to the pilot, or is there a reason why we haven't been part of the pilot up until now?
They just selected randomly, and I don't know how they selected them. They selected Toronto, Windsor, and Kingston as 3 pilots. And we were now brought on as an extension of the pilot work. So now we're just brought on. They want to go from 375 to 1,500. So I think this is like they call it wave 2 type of rollout, and then there's going to be a wave 3 rollout. So I presume there's going to be more. Like I said, we have not. One of the things that I'm a bit disappointed in really is, and frustrated at, is that although we've been told, yeah, we're going to get allocations in your area, you'll be able to work with, here's your allocation, here's how you can distribute it, you can distribute it to your family doctors, but the pharmacies are getting it separately. So it's a kind of a disconnected system, and I've raised my concern about that. I think pharmacies are important, but we should have some kind of more, more of a connectivity and more of a, not relationship, but more of how we can, understand it. But I think it's just a matter of time. Those will then eventually go under our, numbers, because we need to know all the numbers in our area, who gets vaccinated and so on. So I'm hoping that will improve in terms of the communications with us.
Okay, great. And just lastly, you said that before that the staff at the health unit have been overwhelmed with the contact tracing that's been going on, especially when we had like a large volume of cases in a short period. Is the Ministry of Health or local MPPs assisting with lightening the load by getting you like more resources?
Yeah.
To help with that?
Yeah. First of all, we've hired people, so that's not a problem. And what happens is, even with what we have now, they get overwhelmed, and so we do have what's called the Provincial Workforce and through Public Health Ontario that we actually send cases to, so they help us with the contact tracing. So both we have on site, people that we've hired to do contact tracing, and then when they're overwhelmed, we do have backup from the ministry and Public Health Ontario.
Okay. All right. Thank you, and happy Easter.
Same to you.
Next question, Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul. I'm
Hi.
hoping that technology is going to cooperate with me today.
I hear you this time.
Yeah, that's great. That's a really good start. So yesterday, the Ontario Medical Association released a study that named Eastern Ontario as a hotspot for online sharing of misinformation. And I was wondering what you think can be done to combat that, whether people can be educated and reached out to in a certain way that's not been done before.
We're doing our best. We're working with, we do a lot of social media. We're working with a lot of apps that people have to be able to send messages. We do, sessions like this. We're one of the few health units that does this type of, it was initially daily videos and all kinds of things that we're trying to do to offset that. There's a lot of misinformation that's out there, a lot of discontent, particularly, in certain areas of of East Ontario Health Unit about the lockdowns. And so we can't do much about that. It's always a struggle. Vaccine hesitancy is another one that's going to be coming up. With vaccine hesitancy, we're working with some national partners to have some messaging, both for healthcare providers as well as the public. And we're doing as much as possible to ask people to just look at reliable sources about the information before you make any decisions.
That's great. Thank you so much. Have a great weekend.
You too. Thank you.
Next question comes from Bill Kingston, Newswatch Group. For context, is the 15 new Akwesasne cases a true one-day increase, or is that a data catch-up because the number hasn't changed for days?
I don't know. I suspect that it's a data catch-up, but I'm on the phone with them daily, and they didn't tell me that they had previous cases, so I'll have to verify that. Likely, it represents a couple of days. I can verify that, though.
Thank you. Next question, James Morgan, The Review. Please go ahead.
Doctor, the rumor about town here among some people is that half of the patients at Hawkesbury General Hospital have COVID. Can you tell us how
That's
many
what?
people? Half of the patients at the hospital have COVID. I was highly skeptical of that rumor.
No, sir.
I was wondering if I could get some numbers from you.
I can tell you that right now we have on two separate wings, we have total of 28 patients in total that had COVID.
28 patients. That is far from half.
Oh, much less.
Yes, and we will emphasize that.
Please do. Please do. Again, see, a lot of these rumors going around, like Natasha said there, there's a lot of the stuff misinformation going around.
How many staff are positive up at the hospital?
6.
6. Okay. Thank you.
Next question, Thomas Stockton, TVC 22 asks, you said 2 clinics have expanded. Where are they?
Oh, one in Rockland. Actually, gosh, hold on. I have it here. I know that we've added one in Rockland and one in Hawkesbury. And hold on. I wrote it. I took notes when they were telling me. Hold on. Okay, we've added, one in Rockland and one in Cornwall. And then we've expanded the 2 clinics April 7th and April 8th in Hawkesbury and Rockland. In other words, when I say expanded, we added more vaccinators. So what happened was initially because we're doing the 80 plus, we couldn't do more than 300-400 a day, but we're going to go up to like 1,000 a day for those 2 clinics.
Thank you. Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you, everybody. And don't forget, it's Tuesday. And our next session is Tuesday, not Monday. And we will be posting the long weekend, sort of the Friday, Saturday, Sunday numbers on Monday. Okay? Thank you.